Hello all, my name is Nicholas Rolnick and I'm the Human Performance Mechanic, and I wanted to thank you for watching this video. And the purpose of this video is to provide educational content for anyone looking to understand their diagnosis from a medical professional and didn't have the time or the understanding to know exactly what they're dealing with. So this video will be short and sweet and will allow you to have a greater understanding of what you're currently dealing with. So what is it? What is tennis elbow or lateral epicondylitis? Well, we should just have a brief overview of the anatomy of the region. And so tennis elbow is a condition that affects the elbow. And so if you look at the picture right over here, you can see circled in black is the common extensor tendon. And this region has been thought to be strained when undergoing activities that involve repeated gripping, rotation of the elbow, or eccentrics, which is when the muscle is lengthening while under a force, such as that occurs in playing tennis. That's how it got its initial name. And so what ends up happening is it was theorized that there are micro tears that occur along the extensor tendon, most commonly in extensor carpi radialis brevis, which is involved in extension of the wrist. And so individuals with tennis elbow are going to have pain with gripping and carrying objects, extending the wrist, and if the condition is severe enough, will have pain at rest. And what's interesting is that the most recent evidence that has come out has said that this is actually not a tendinitis, so to speak, which is an active inflammatory condition, but actually a tendinosis. And a tendinosis is a degenerative process that happens over a long period of time and that accompanies cellular changes in the muscle belly, as well as even some central nervous system changes. And so that kind of frames how we approach treatment of this condition. So what can physical therapy management do? Well, first, we need to rest from the offending activities. So as shown in the top left picture, we want to just refrain from anything that really is going to aggravate the issue. That's first and foremost. And so being able to rest from the offending activity is going to give the body a chance to heal. And a lot of the times with these degenerative or active inflammatory conditions, we don't give our body enough chance to heal. And that's why rest is so important. And it's not complete rest, it's relative rest. And with that, I mean that we're going to still be exercising. That's the next step. That's the one on the right of that. Doing wrist extension and wrist flexion exercises, which is this motion right here, because we want to strengthen that region. So it's resting from the activities that are causing you a lot of pain and discomfort, but allowing strengthening of that region to accommodate the loading that is necessary and needed to sustain that activity. And so what physical therapy will do is it's going to look at your range of motion, not only your elbow in all of these motions here, but it's going to look at your shoulder range of motion, it's going to look at your wrist range of motion and elbow range of motion, as well as some of the motion of your neck and upper back. And I say this all because it's important to understand that your body is connected, in that the joints are going to be pick up slack, so to speak, for other joints that aren't moving as well. So it's really important to identify areas where there is not enough movement and target them to increase their movement, because that's going to then reduce stress on all the other joints. Because if a joint doesn't move, another joint's going to move more to accommodate for that. And so that's really important to understand, in that you're going to go to a physical therapist or a movement professional, and they're not going to necessarily target just the elbow or the site of pain. And so taking range of motion measurements is going to be really important, as well as looking at the strength of not only the affected elbow, well, by gripping using a dynamometer. So it's going to give you, the physical therapist or your practitioner, a good idea of how strong you are before the level of pain, before you start experiencing pain, as well as giving a good comparison to the opposite side. More recent evidence has also come out to look at the importance of the shoulder blade muscles, so the rotator cuff muscles, the serratus anterior, and some of the other muscles that control the shoulder blade or the scapula, and how that also reduces the demand of the wrist extensor muscles. So a common examination will also include looking at the strength of those muscles. And so that's as pictured in the bottom picture as well. If the condition is really acute and painful, a counterforce brace will be recommended as a temporary relief for the pain that you're experiencing, and that's in the upper right. And finally, it's also worthy to mention that the elbow in that region can commonly mimic some neural tension, and neural tension is a situation where the nerves just aren't moving as well as they should. And so sometimes, especially with conditions like radial tunnel, where the radial nerve is just kind of not like stuck, so to speak, and it gives a pain in the general region of where someone would experience tennis elbow. Well, the physical therapist is going to look to make sure that the mobility of those nerves are optimal, and if they're not, prescribe exercises to kind of help alleviate some of the tension or the lack of mobility in between, and that will give additional pain relief. So how long will it take? That is the golden question. Well, this condition is known as self-limiting, meaning that if you just don't operate in pain, this condition will heal itself within 6 to 12 months. A lot of people don't want to hear that it's going to take 6 to 12 months to get back to playing the sport that they love or doing household chores without pain, so they come seek a movement professional such as a physical therapist. And so there's evidence that corticosteroid injections help in the short term, but really there's no difference between short-term gains and long-term prognosis, meaning that just because an individual has a corticosteroid injection by a physiatrist or a medical physician, that they will be any better after 1 year than an individual who does just conservative management. However, I will say that corticosteroid injections provide some pain relief, but provide that pain relief as in a window to address the impairments that were noted in the physical exam. And so this condition takes a little bit of time to heal because it is a degenerative condition. It is source of pain. And so making sure that you're adhering to your home exercise program that's been given to you by your human movement professional and coming to therapy to work on the strength and the range of motion impairments that have been seen in the physical exam will help expedite your healing process. So I wanted to thank you all for watching this video, and I hope you've learned a lot. Please leave a comment in the comments box, and I look forward to making another video next week.